Hello, I'm Adela Castro at ACR 2024 in Washington, D.C., and I want to tell you about the CLASSIC study, which is abstract 0820. So the CLASSIC study is a large prospective multicenter trial that included over 1,000 patients with chronic back pain, and the investigators aim to evaluate the performance of the ASAS 2009 classification criteria for AXPA in this patient population with an endpoint of obtaining more than 75% sensitivity and over 90% specificity. Diagnostic assessments were performed in 5 stages. The first stage was after the history and physical exam. The second stage was after obtaining laboratory, which included evaluation of CRP and HLA-B27 positivity. The third phase was by plain radiology of SI joints, which was read by a local radiologist. And then the fourth phase was actually the MRI evaluation of the SI joint, which was read by the local radiologist. And the fifth phase was the overall compilation of the history, the exam, the laboratory, the x-rays, and the previous MRI that were interpreted by central radiologists specialized in imaging of the SI joint, and there was an adjudicator in case there were some discrepancies between these two central radiologists. The patients that were classified with AXPA had some common clinical variables. Most were male. Most of them had inflammatory back pain. There were highly chances of them having peripheral arthritis, dactylitis, anterior uveitis, and compared to the non-AXPA patients. Also, as we can imagine, the labs were elevated CRP and presence of HLA-B27 positivity. And imaging patients that had AXPA were most likely to have a positive X-ray findings and MRI findings. Unfortunately, the 2009 ASAS classification criteria did not meet the set targets of 75% sensitivity and 90% specificity as the investigators were expecting, which is going to lead to the revision of these criteria, which I think is going to be very helpful to have better accurate criteria, particularly for the classification of patients appropriately for research trials. And then, it's going to be very important, of course, a lot of what they found in the results was something about the imaging. So there was a lot of overdiagnosing on imaging, particularly on MRI in the local radiology. So it definitely involved, education for our radiologists that are reading MRIs to kind of look more into what are the specific findings required to classify these patients as AXPA. For more information, go to roomnow.com.